Good afternoon and welcome to Wednesday Wellness, a free live educational series brought to you by Trinity Health. We're thrilled to have you with us as we dive into the important topic of pelvic floor physical therapy. Before we get started, here are a few housekeeping notes. Your cameras and microphones have been turned off to ensure a smooth experience. If you have questions during the presentation, please use the Q&A chat feature located at the bottom of your screen, and our presenter will address these questions at the end of the session. Lastly, today's webinar is being recorded and a link to the video will be sent to your email in the coming days. Without further ado, it is my pleasure to introduce physical therapist Jill Howell.
Okay, welcome to Pelvic Floor Therapy 101. I'm Jill Howell, and I am one of 4 physical therapists at Trinity Health Muskegon that does pelvic floor therapy. I have 18 years of experience with pelvic floor dysfunctions as well. So let's get started. Okay. What is pelvic floor therapy? It is the treatment of bladder dysfunctions such as urgency or frequency, the I gotta go, or multiple times going in less than 2 hours. Bladder retention or incomplete emptying, where you have a slow urine stream or a weak urine stream or it's not emptying fully on the way out. You can also have what's called a prolapse, and you can have multiple different kinds of prolapses. Common ones are the bladder, the rectum, or the ureter. And they can cause lots of different complications as well. Another reason for bladder dysfunctions can be enuresis, and those are typically for children, and we treat children anywhere from 5 years and up, and enuresis is for bedwetting. Another part of pelvic floor therapy is bowel dysfunction, and you can have constipation where you're not having a bowel movement frequently, typically every 1 to 2 days, or you have leakage of bowel. Another area of pelvic floor therapy is the treatment of pelvic pain, and that is vaginismus, which is painful intercourse or penetration of the vagina. Vulvodynia, which is pain around the outside of the vagina, also known as the vulva. So you're having discomfort around that area with either clothing or sitting or any of that kind of stuff. You can also have bladder pain, or it's commonly called interstitial cystitis, and it's pelvic pain or pressure or frequent urge to void. Also, another part of pelvic therapy is pregnancy. We see pre and postpartum people for pregnancy issues. Usually they have to come with us with the diagnosis of they're leaking or have pelvic pain or having issues after birth. They also can have what's called diastasis recti, or splitting of the abdomen. When you have the baby, it usually, your belly expands and then a muscle down kind of has to expand in order for the baby to grow. So that can start to cause problems and dysfunction, and you can have pain and other issues after having the baby. Also, scarring from the vaginal birth can cause issues down there, as well as scarring from the C-section. Okay, so the pelvic floor. The pelvic floor makes up 1/3 of the pelvic pyramid. And as you can see on this drawing, the pelvic pyramid is consistent of the pelvic floor, which is the bottom, the transverse abdominis, which is the front, your lower set of abs, and the multifidi in the back, which is part of your low back. So if you have problems with one of these areas, typically the other areas also have problems. All 3 of these units are working together not only to help support and stabilize the low spine and pelvis, but they help support the organs as well and helping them perform properly. So you can think of this unit as your floor and your core. This next slide actually shows the pelvic floor as you're looking down through your head into your spine and your hips. So as you can see, all of these muscles here are considered part of your pelvic floor. And when you think about these muscles, there's not any structure underneath them that actually holds them in place. The muscles have to work extra hard to keep everything in your gut and abdomen in there and not from coming out. So we think of these muscles as your stabilizers. But when you think of them, you don't necessarily have to think of them to work, because we never really thought, hey, I have to work out my pelvic floor. But in essence, you do. They're not like the muscle of your heart where it automatically just works. These muscles are just like your bicep of your arm or anything else, and we have to have them working properly, so we have to exercise them as well. They can be tight and they can be weak, so we'll get into that later. So what is normal bladder health? The average bladder can hold 2 cups of urine before it needs to be emptied. A normal range of voiding urine is 6 to 8 times a day in a 24-hour period. As we age, though, our bladder capacity can get smaller and you can go a little bit more frequently. But voiding should not exceed once every 2 hours. So if you're going every hour, half hour, or 10 to 15 minutes, you do have a bladder dysfunction. Urine stream should flow easily without straining or pushing. It also should be a strong flow and not a weak or like splayed, like where it kind of sprays for a little bit and then you have a strong urine stream. It should just be constant the whole time. An urge is a signal you feel as your bladder stretches. So that is what tells your bladder that you need to go to the bathroom. Urges are not commands to go to the bathroom, but rather a signal that can be controlled. So when you get the urge, you should be able to hold it in order to get to the bathroom. It shouldn't be like, oh my gosh, I have to go right away, and you have to run to get to the bathroom. You should be able to slowly get there and walk to the bathroom. So bladder facts. There's no waiting to go to the bathroom. So when you have the urge, you need to act on the urge and get there, but you can delay your urge as well. So if you're going every 15 minutes or half hour, we do like you to delay your urge because you should be hitting that 2-hour mark more frequently. There's no just in case peeing. Just like we tell our little kids, like, hey, let's get to the bathroom before we get in the car because we can't stop or do any of that. We shouldn't do that as adults because we're just teaching our bladder at that time that when I only have a little amount of liquid in it, that I need to go to the bathroom, and it thinks it's full at that point. So we need to be able to teach our bladder what a full bladder is. Also, sitting all the way on the toilet when you go. There's no hovering, there's no sitting on one cheek, because when you do that, the muscles of your pelvic floor put on tension, and then you might not empty all the way or fully, or you can't start your stream because the muscles are in spasm, so then it won't let you go all the way. So being able to be on the toilet with both cheeks on the toilet and sitting down is very important for your bladder health. Also is wiping front to back. We want to be able to do that because otherwise when you wipe back to front, you could get some of like your stool in there, and then that can cause UTIs and also frequent urination as well. So we want to have a clean bladder health. So we want to avoid those UTIs as possible. Also, bladder irritants are things that actually can make your bladder seem like you have to go to the bathroom more frequently. Those things can be made up of different foods or drinks, and most of them are caffeine, citrus fruits, which can be, grapefruit is probably the worst one, but like pineapple and oranges and lemons, spicy foods, any tomato-based products, some milk products, and artificial sweeteners. So if you have these items, they have a higher content of acid in them, and it can trigger your bladder to feel like it has to go frequently. So if you have those items and you're finding out that you're going to the bathroom quite a bit, you might want to back off on some. Now, all these items might not affect you, but they can affect you. So you'd have to kind of see like, okay, if I have this coffee, am I going to go to the bathroom more often? But some people will be like, oh, I can have coffee any day and I'm totally fine. And that's the case with anything that we find food related. So you just kind of have to kind of pick apart like what is your trigger or what is not your trigger. So this is a bladder health quiz. And if you answer yes to any of these or most of them, then you probably have an issue with your pelvic floor or your bladder, and it would be a good idea to see a pelvic floor specialist. So rate the following statement as it applies to you today. My bladder is controlling my life. 0s, it's not true at all. You can go around your whole day and not have to worry about anything. I don't have to look for bathrooms. I don't have to plan my stops or any of that. Or 10, it's completely true. My bladder controls everything. I'm thinking when I get into a store, I have to know where all the bathrooms are. Or if you're driving across the state, you know where the rest stops are. Those kinds of things. Or if you go to a friend's house, like, hey, do you have this? Do you have a bathroom over here? Is it readily available? And are you bringing your pads because you're leaking all the time? Or you go on a walk and you can only walk for 20 minutes because you know after that amount of time, you need to stop and find a bathroom. So is it controlling your life or is it not controlling your life? Do you urinate more than every 2 hours in the daytime? And that goes to the fact like, okay, I'm going 5 minutes, 10 minutes, 20 minutes, 30 minutes, or every half hour to an hour. That is not normal. Okay. Do you urinate more than once after going to bed? You shouldn't have to wake up more than one, sometimes two times a night with the older population to go to the bathroom. If you're waking up every hour or every couple hours to go to the bathroom during the night, that is not normal. And there can be many different things on why that is. Do you have trouble making it to the toilet on time when you have an urge to go? When you have that urge, are you the person that like, okay, I have the urge, and then you go to get up, and as you get up, you just leak? Or you have the urge and then you start going to the bathroom and you can't make it. Or you have the urge and by the time you get to the toilet and take down your pants, you're already going. Those things are not normal. Also, do you strain to pass urine? Are you kind of pushing in order to pass all of the urine or get it all out? Or are you pushing and you're like, yeah, I still have the urge to go and nothing is coming out? That could be caused by some muscle spasms, and those might need to be released in order to help you go to the bathroom. Okay, continued. Do you lack the feeling that you need to go to the toilet? Can you not tell that you have to go to the bathroom? And then all of a sudden you have to go and you can't make it and you never got the cue that I had to go to the bathroom? Do you empty your bladder frequently before you experience the urge to pass? Are you one of those people that are like, okay, I know if I have that urge that I need to get to the bathroom, so I'm going to get to it before. At that point, you are consistently treating your bladder or telling your bladder that if only I have a certain amount of liquid in it, then I can go to the bathroom. So you're basically telling it that the small little liquid is when I need to go. And then you're sending off your cues in the wrong direction. Do you have a feeling that your bladder is still full after urinating? Then you're not emptying fully on all the way. Do you experience a slow or hesitant urine stream? That would also mean that you have spasms and something is not working correctly with your pelvic floor or it's uncoordinated. Do you have difficulty initiating the urine stream? You sit down in the toilet and you're like, okay, I gotta go. but nothing comes out? Do you have triggers that make you feel like you can't wait to get to the bathroom, like running water or the key in the door? That's a common one for a lot of people, but they don't understand what the key in the door is. And that's when you get into your house and you're trying to open up the door to either the bathroom or the house, like into your normal house, and you can't get the key in and you start doing the little dance. That is what that means. Are you unable to stop the flow of urine when on the toilet? Can you contract those muscles to stop the urine? That is a Kegel, essentially. But do we want you to practice that on the toilet when you go to the bathroom? No, because that will just mess up your whole pelvic floor. We would rather have you practice that when you're not on the toilet and going to the bathroom. But that is a key. If you can stop your urine, then you're strong enough and able to do that. Do you have an urge to go, but when you get to the toilet, very little urine comes out? That could mean you have discoordination of your pelvic floor. Okay, causes of pelvic pain. So there are many different causes of actual pelvic pain. Interstitial cystitis is one of them, and we talked about that, where the bladder is full and it makes you feel like you have to go all the time and there's pain. Another one is dyspareunia, and that's painful intercourse. Others, muscle spasms. Are your hips aligned? Are they misaligned? Do you have back pain? Do you have hip pain? All of those things can tweak the way that the pelvic floor is. Because if you think about looking at that pelvis that I showed you on that one slide, if one of those muscles is in spasm, it kind of tweaks that whole system. Also, one that we don't always think about, but it can happen, and I've seen it in my years of experience, is labral tears of the hip. So if you have a hip dysfunction or tears, it can actually make those muscles of the pelvic floor spasm and cause other issues as well. Postpartum pain, after you have the baby, then you can have all kinds of pain of those muscles not getting back together. They're uncoordinated because of the trauma of the birth. There was a tear, just all of those different things. Endometriosis is another one, and that's due to inflammation and scarring from all the endo that's in there, and we can do a lot to help treat that as well. And then just normal scar tissue from trauma. Were you in an accident of some kind? Did you have trauma to your hip? Did you have trauma to your back? Did you have trauma to your abdomen? All of those things can cause pelvic pain. Okay, now getting to constipation. So constipation occurs when the colon absorbs too much water from the stool and the colon's muscle contraction is slow or sluggish in the delaying of the transit time. So it can't move as fast through. So no bowel movements for 3 to 7 days is not normal and considered constipation. So let's find out what is normal. Okay, well, causes of constipation can be these 3 things. Lack of hydration. Are you not getting enough water during the day? Because the water helps move the stool through the colon. Are you not getting enough exercise? Are you not walking? We find even in the hospital, like after surgery, like you always hear about people saying, well, if you just walk the halls a little bit, maybe that will help your bowel movement. Come on. There is a component of exercise to that to kind of help things keep moving. And also a lack of fiber. Okay, constipation. Bowel movements fewer than 3 times a week. So you're not going 1 to 2 times a week in a day, or not a day, but like a week. You have hard stools. It's difficult for you to pass. You're straining a lot to have a bowel movement. You're having to push and it's not coming out. And it doesn't feel like you're done, but nothing else is coming out as well. Those are all signs of constipation. So when you come to therapy, we usually like to give this little scale. It's the Bristol Stool Scale. You've probably seen it. It's been out a lot lately. But normal bowel movements are a type 4. So that sausage or snake, sometimes we call it the banana, It's smooth, it's easy to pass, and you don't have to worry about anything. Anything above that number 4, a 3, 2, or 1, we consider that constipation. A little bit harder, a little bit more rigid. You have to push for it to come out. And then anything below, we consider it diarrhea. So type 5, 6, or 7. Okay, toileting habits. So it's good to consider toileting habits, especially with constipation. You want to do a bowel routine. So it can take more than a week or more to change a bowel habit. But establishing a routine of like getting up and going to the bathroom at a certain time, eating your meals at the same time every day, and not introducing new foods too much in your diet will help kind of introduce that bowel habit, and then you can go at a certain time every day. Also, we want to use exercise, diet, including that fiber, colon massage to help stimulate the BM. And when you do a colon massage, you always want to go clockwise on your stomach, thinking of your head as 12 and then your pelvis as 6, and moving clockwise. So you're moving in the order of your large intestine and how the bowel moves through it. You do not want to delay the urge of any kind for bowel movement. You want to make sure you act on that right away, because we don't want to give that any delay in action. And you want to allow no more than 10 minutes on the toilet. If you're unproductive, come back and try again later. But when you're on that toilet and you're sitting there more than 10 minutes, sometimes that can put a lot of strain and pressure on that pelvic floor. And remember, there's not any bone underneath that pelvic floor to help stabilize it. And you have all of those organs sitting there. And if your floor is not strong enough to hold it, it can actually weaken it over time. So we like to talk about the squatty potty in the pelvic floor world. Putting your feet up on a stool is an easier way to have a bowel movement and causes less straining overall. And it's because squatting will have a bowel movement changes the anorectal angle and may allow easier defecation. So if you look at the two pictures, the one with the feet on the floor, you can kind of see it kind of has a kink in that bowel with the pubal rectal talus muscle, but the one on the stool has less of a kink, so it allows things to drop easier down. So, I mean, if you've come to our clinic, usually everyone that walks through our door is recommended to get a squatty potty. Okay, so what to expect during a pelvic floor evaluation? So always we are one-on-one treatment with a therapist, and you will always see that therapist when you're with us, unless sometimes one of us specializes in a little bit more and we might be like, okay, we really want you to see so-and-so if you're comfortable with that. Otherwise, our rooms are private and you have one-on-one direct care with us. So during the evaluation, we want to understand the symptoms that you are having and what are your triggers? What are the things that's causing you to come in? What are the things that causes you to leak or causes pain? We want to know about all of it. We're going to ask about your past medical history too, because all of the different surgeries that you could have had to your back, your hips, your abdomen can all affect and play a huge role into that pelvic floor therapy. We're going to ask about your diet. What are you eating? What are you not eating? What are you drinking? How many times during the day do you go to the bathroom? What have you tried in the past? We want to know, because if you've tried it and it's failed, then we might not try that. We're going to do a general low back exam and hip exam, check your flexibility and alignment and your strength, poke around, look at all of that stuff, and make sure none of that is contributing to the issues that you're having. And then if you're comfortable, we'll do an internal examination. It is hugely important that we do that, because we don't know, do you have a tight pelvic floor? Do you have a weak pelvic floor? And if you have any of those, it could cause leaking. Both of those can cause leaking. Both of those can cause pain. But we won't know until we actually get in there to know exactly how to treat you appropriately without doing that. But if we do have an internal exam, we will ask if you need a chaperone in the room as well. So when we do it, we're going to check your muscles. We're going to poke at them and palpate them and see if they're in spasm. We're going to do a strength check. and we're going to do a prolapse check. Then we're going to let you get ready, get dressed again, and then we'll come back and educate you on the findings that we found. And then we're going to go over the treatment options that would be beneficial for you and give you somewhat of a home program to start with. Okay, so possible treatment items that you could have coming to pelvic floor therapy. Strengthen your core, hips, and your back. Strengthen your pelvic floor with and without biofeedback. So biofeedback is a way that we can do Kegel exercises where you can kind of see what's going on. So we use external electrodes or internal electrodes through the vagina. And we hook you up to a machine, and the machine can't see inside your body, but it can show a graph. And when you do a Kegel, the graph should go up and then come down when you relax. And that is going to give you a lot of feedback to see like, oh, I did it, but I don't see anything happening. Or I did it and I can't relax after my contraction. What if I try to squeeze this way or that way? So that machine gives a lot of feedback and kind of helps you know that, oh, I'm not contracting the right muscles, or, oh, yeah, I am. So I can continue with what I'm doing. We can also strengthen with stimulation. So that biofeedback machine also gives some electrical stim to kind of wake those muscles up to help control, to get that strength to go again. Because sometimes they end up a little sleepy, especially after trauma. We also do internal trigger point release, where we have our hands and we kind of get those muscles to relax enough. A lot of that was with spasms and a lot with pelvic pain and even with leaking. We have found that your muscles, when they spasm, can cause you to leak as well. We also can educate you and dilator you, so you can do that at home so you don't have to be coming to see us as much. Also, we can do internal stim to also relax those muscles as well. We talk a lot about breathing and relaxation techniques to help kind of get the urine out and relax the pelvic floor. Your diaphragm is a very important tool of your pelvic floor. And if it's not working correctly, the pelvic floor won't work correctly. We also do cupping. So we can do it on the abdomen or the back to help break up adhesions and get things moving. We do muscle energy to help with alignment. We do balloon retraining for bowel dysfunction and constipation and bowel leakage as well. We give education on bowel and bladder, and we also do manual manipulation of the abdomen. Okay, so here's just some tidbits that you can leave to learn a little bit about bladder urge. So hydration. Staying hydration is the key to a healthy bladder. Limiting fluids with the intention to decrease trip to the bathroom can backfire, leading to more concentrated and irritating urine. And then you might feel like you have to go more. So water helps to dilute the urine and making it less concentrated and therefore less irritating. Plus, it helps flush out the bad stuff, keeping your urinary tract clean and fresh. Constipation. Are you constipated? Did you know frequent constipation can create bladder urge? Because a full rectum can push on forward towards the bladder, decreasing the bladder's capacity to fill, causing an increased urge. Okay, dietary irritants. Kind of touched on this a little bit, but some foods and drinks are not your bladder's friends. These include spicy foods, caffeine, alcohol, and that bubbly water. Mix water in between these foods and drinks to help make the bladder less offensive. And, kind of dilute that urine a little bit, because otherwise it gets really acidy and then you feel like you have to go. Okay, pelvic floor fitness. Urge can be related to a weak and a tight pelvic floor. So practicing coordinated pelvic floor strength plus focusing on hip rotation and abduction. Okay, bladder boss training. You can be in control of your bladder, working on increasing your holding time for short durations. So if you're going to the bathroom every half hour and we need to increase that urge, you can practice by increases in 5-minute increments and be like, okay, I can hold and relax and kind of breathe. And then you'll be able to teach that bladder and nervous system to tolerate that stretch. And then you'll get more normalized. Okay, so when to look for a pelvic floor specialist. Are you leaking? Do you have pain? Are you pre or postnatal with issues of leaking, pain, or discomfort? Are you not able to empty your bladder all the way? And do you have constipation or leaky bowels? Those are reasons to find your pelvic floor specialist. Now, how do you get your appointment? Well, contact your PCP and let them know of the issues you're having. If you have a urogyn or an OBGYN, talk to them as well. They are very good at referring you to pelvic floor therapists. Also, if you're having the bowel dysfunction, you can also go to your gastrologist and they can send the referral in. Once you have that referral, you could call us directly at the Lakes Rehab and get scheduled, or call our centralized scheduling number and hit option 2, and they can get you scheduled. We are scheduling out a few months, and it's primarily because we only have 4 physical therapists that work on it in this area, and we are backlogged, but you also get one-on-one treatment. So that is why our wait times are a little bit longer, and it's a little bit harder to find those therapists because they're out there and we have a lot of them in the area, but we all have the same issue because it's one-on-one treatment and we don't pass our patient. Any questions?
Thank you, Jill. So we are going to transition into our Q&A session. So if you haven't already, you may submit your questions using the Q&A chat feature at the bottom of your screen. And Jill, I will go ahead and read off the first question for you to get us started.
Okay.
It reads, I was recommended possible pelvic floor PT for tailbone pain. Can you please talk about how PT would help with tailbone pain?
So your tailbone is connected down to your pelvic floor. As you looked at that one model on the screen, let me see if I can backtrack it for us. Okay, here it is. So the tailbone is down part on, so they have the sacrum and the coccyx right there. The coccyx is right down and it hooks into your pelvic floor muscles. So we can help by doing external and internal trigger point release to help kind of get that to move and get that pain to lessen, because more than likely either the muscles are really straining, like you could have had a fall, you could have had a birth, there's a lot of different things that can affect that tailbone pain, and we have seen a lot of success with it as well. We also do taping and things like that, and then just working on that strength of the core and the hips.
Perfect. Thank you. We have another question asking, what about club soda with fresh fruit and herbs? Is it the carbonation that is the issue as an irritant?
It is the carbonation that's the issue. So all carbonated drinks definitely are an issue. So that carbonated water, even though like it is fun to drink and it tastes better than just plain old water, can be an issue. It's the bubbles that cause that issue of having to go all the time. It also could be what you're putting the fruit-wise in though too. Like, are you putting lemons in it? Because lemons are a little bit more citrusy, and that could also be an issue.
All right. We have a question asking, what is cupping?
Cupping. So if you watched the Olympics at all this summer and you saw some of those swimmers and they had what looked like hickeys on their back, so what they use is these little cups. And what we do is we put them on your stomach and then draw the air away, and it pulls your skin up into the cup and holds. And then at that time, you kind of move them around, and it kind of breaks up the skin and brings like healing to some areas and blood flow to the area, and also breaks up scar tissue.
All right. Our next question is asking, are there any best practice exercises that you would recommend for pelvic floor?
So that's a hard one because I don't know. Do you have a tight pelvic floor or do you have a weak pelvic floor? So it's really hard for me sometimes to just be like, okay, try this. If it doesn't work, then comes, well, I mean, you could try Kegels, and if it doesn't work, I can't guarantee it's going to work for everyone, that go see your pelvic floor therapist. But definitely working on your diaphragmatic breathing or belly breathing is a very hot topic right now and helps that pelvic floor. And that is something that anyone would give you right off the bat.
All right, thank you. Our next question is asking, I have a history of adhesions, hysterectomy with, and I apologize, I'm not going to say this correctly, I think oophorectomy.
Yep.
Will adhesions return? I have noticed occasional pains.
So adhesions after surgery, common. You're going to have them until someone can go in there and like work on them either internally or externally, like from a therapy point. If they open you back up, you have the chance of getting more adhesions. There are times that they open you back up to take out the scar tissue, but it still will go in there and make other adhesions as well. Physical therapy can help greatly with that to help break up adhesions and then trying that kind of thing. I've had it myself. I've had the hysterectomy. I've had adhesions, and they can be very painful. So if you can find someone that can do a lot of abdominal work or anything like that, that really helps out that area.
All right, thank you. We have another question asking, is waking up one time in the night to use the bathroom normal?
Yes, that is completely normal. Usually we say 1 to 2 times a night is fine. Once you start getting more than that, then that's the issue.
All right. Next question is asking, are there any resources that one could use to learn how to properly do a Kegel exercise?
There's a lot of them out there right now. You could, let's see. I don't know any off the top of my head that's a really good source for doing that. If you just think, I would probably, the best way, look up Kegels online and see what you can do, but just know that you're not supposed to tighten your abdomen, your buttocks, or hold your breath or get your legs involved. So it's just strictly those pelvic floor muscles, and you're pulling up and in, not pushing out, because we don't want to push anything out of that area. So you want to pull up and in. So doing a Kegel, you could think of it as if you're like, if this was the opening and you're sticking your finger in, you're feeling a tight squeeze and a pull up. So that's what you can think of. And those are items that you can work on at home. And if you're really wanting to know if you're doing it right, stick your finger in and see if you can feel that tight squeeze and you're pulling up.
All right, thank you.
Mm-hmm.
Next question, can pelvic floor therapy help ischial pain?
Ischial pain?
Yes.
Yes, it can. So like I said, on this little diagram right here, your ischium is like right at the bottom of these two big bones right there. And it sits right down next to that pelvic floor. So yeah, that can definitely help. Pelvic floor therapy can definitely help that as well.
All right. I think this is more of maybe a yes, no question specific to one individual, but if they are having bowel movements a number of times a day, often when walking or working out, is that something that PT could help them with?
Yes.
All right. Does someone require a referral from a physician to be seen by you or your office?
So I would say yes, we are under direct access, so we can see you for a short period of time without a referral, but your doctor has to initially, in the end, sign off on it to be seen continuously. So yes, I would say you need to have a referral from your doctor or your OB or gastro or urogyn.
All right. Our next question is asking, I have had 6 hip surgeries and 7 abdominal surgeries, so I have scar tissue. How would therapy help with scar tissue?
It's going to help break it up so you don't have as many limitations with that kind of thing. It's going to help things move a little bit better. It's going to help the mobility of your hips, your abdomen, your gut, all of that stuff.
The next question is asking, my pelvic floor seems much weaker around or before the time of my period. Is it normal or is there an underlying issue?
I have heard of people complaining about that recently. It's probably hormonal related. I don't know for a fact if that is, but I have had people that have come in and we've treated them. Usually there's an underlying issue. Usually they're weaker at the other times. It's just that when your uterus is distended because it grows so much when you're on your period, so it has all of that pressure. So there's usually an underlying like pelvic floor issue with the weakness there.
All right, thank you. We have another question asking if you could elaborate on what an internal exam exactly means.
Okay, so an internal exam, we'd have you laying on the table. It's kind of like your OBGYN. We do not have any stirrups or anything at our office, but what we do, it's from the waist down, you undress, and then we would kind of visualize that area, look at it, see for redness, irritation, and then we kind of open you up a little bit into the vagina only, and stick our finger in and kind of poke at those muscles. There's 3 different layers of your pelvic floor muscles, so we kind of go through each of them, and then we see if you can do a contraction. So that, and then we look for the prolapse. So we kind of have you bear down a little bit as well and kind of see what happens in that position during that. The internal exam, honestly, is probably the quickest you've ever had, and it doesn't take very long.
All right, thank you.
Mm-hmm.
Our next question is asking what can help with stress incontinence, for example, from jumping rope?
Okay, so typically stress incontinence can be from a weak pelvic floor. So the Kegels and then pulling in some core and some hip stability as well can help with that stuff too. It also can mean a tight pelvic floor though too. So you may want to be checked out just to make sure, because if it's a tight pelvic floor, then we need some more stretching and breathing and some other things that we need to look at as well there. But definitely try the Kegels first.
All right. Our next question is asking walking, weights, running, or bicycle. What exercise do you recommend is best for mild prolapse?
So I would say you could walk, you could bike, you could do some gentle weights. I wouldn't do really heavy weights, like, because we don't want it to drop anymore until you can get your pelvic floor strong enough in order to adhere to some of that stuff. Definitely not like the pounding, like the running and that kind of jumping kind of thing, and like really heavy weight. But walking and biking should be great. Swimming is another really good one too.
All right, thank you. This is, I think, another one of the yes, no, should they be seen questions, specifically asking, would this help with the urge to go to the bathroom as soon as you stand up and start to walk?
Can you repeat that for me?
Yes, yep. I think what it's asking is if someone is having to immediately go to the bathroom once they stand up and start walking, is pelvic therapy something that could help them?
Yes, definitely.
All right. Next question is asking, I had surgery to remove a small tumor on the urethra. The surgeon said I had a lot of scar tissue. I've had a hard time holding urine. What is the best thing to do to help this?
Find your pelvic floor therapist.
Perfect. One of our questions is asking, will this webinar be available later for viewing? I'm happy to take this one. It absolutely will be. We'll be sending out a follow-up email in the coming days with a recording to this webinar. So you will be able to rewatch if you've missed any, or if you joined late, or if you'd simply like to review again. One question is asking, what about strengthening if leakage occurs with running, jumping, or physical activity? So I think this is a yes, no as well.
Kind of. It can be strengthening, yes, eventually, but if you do have a tight pelvic floor, then we might have to relax it first and then strengthen it.
All right, thank you. The next question, sorry, I'm just trying to make sure I don't reread one that we've already addressed. One person is asking, I don't really have any of these issues, but I am pregnant with my 6th full-term pregnancy. I do have to empty my bladder if I jump on a trampoline. Could I still utilize pelvic floor things to tighten muscles and regain control of my bladder?
Yes. You could, yeah. You could come to pelvic floor therapy because that sounds like you have somewhat of an issue with things. So then we could do something and then send you on your way. And then after the baby's born, then you could come back and do some more therapy as well.
All right. Next question is asking, I had trauma to my pelvis last year. They broke 4 bones. And sorry, I think it says CI joint and iliac crest. I'm 26 years old and still want to have children. What exercises would be best for natural birth?
So that's hard to say until someone would do a complete exam on you. But, core exercises and hip exercises are really good to do that, and trying to do some Kegels as well. But I would recommend seeing someone and so you could get a good plan going.
All right, thank you. Next question is asking, if I need to splint frequently with a bowel movement, does this mean my pelvic floor is weak?
It could mean you're weak or you're tight. It's the theme of the day.
Perfect. And next question is asking, what is the average length of treatment time?
So that can vary. So I can see people for like a one-time visit and give them things to work on and go. But typically they run from, we see them once a week for 1 to 2 months. Sometimes more depending, but usually 1 to 2 months.
Okay, thank you. Next question, you define normal urinary frequency bladder control. Is there a different normal when pregnant, or would those be the same parameters? And would
different.
you use, yeah, I think there's a little bit more, and would use to determine if someone should see a pelvic floor therapist when pregnant?
So it's definitely different when you're pregnant because you have a lot more going on in there and it's pressing onto your bladder. Sometimes baby likes to sit right on your bladder. So you tend to go a lot more frequently when you're pregnant. So honestly, that's probably not an issue during pregnancy, but if it continues after, I would go see a pelvic floor therapist.
This one is not a question, but I did want to share. Jill, you did a fantastic job. Jen and Jill are very knowledgeable at what they do. Next question, what are typical symptoms of weak pelvis and then symptoms of a tight pelvis? Are we able to tell the difference because of symptoms?
Not 100% true. You cannot 100% true tell the symptoms of them. Sometimes the pain factor will definitely be a thing with pelvic pain people or a tight pelvic floor. So they typically end up having more of the spasmy tightness of it. But I mean, I have seen a lot of people, and especially recently, where they come in and they're like typical leaking, and you think that you're going to just start the Kegels, and then you try them and you're like, yep, nope, that's not where it's going. And you end up switching your whole treatment method. So usually like the leaking, the jumping and all of that, yes, you think of a weak pelvic floor, but it's not always the said case.
Perfect. Thank you. Our next question asks, I have an electric spasm work twice. I've had an electric spasm work twice. If I keep forgetting to do Kegels, can I pick up doing Kegels and get better from leakage?
Yes.
Perfect. And next question, can you please briefly address fecal incontinence due to loose stools?
So fecal incontinence due to loose stools is typically a coordination of pelvic floor issues or the rectum. Like it could be you're backed up with constipation and it's leaking around, or it could be that you're just losing the stool because of your weak muscles in your rectum as well. And we would do therapy to do that. We typically use a balloon for that kind of therapy at some point in time to see if the coordination of being able to pass the balloon is the, or if you're not being able to pass it, or the feeling that you get. Like, so if you blow up the balloon to a certain spot, you should be able to see it at or feel it at that point. And then once you feel it, pass it. Some people can't feel it until it's huge. Some people can feel it right away. So are they hypertonistic or very spasmy down there and they need a release? That kind of thing. So I hope that answers the question.
Thank you. Perfect. We have another question asking, they are currently in PT due to a car accident, and they're wondering if they can do pelvic floor therapy at the same time while they're in PT, or should they wait?
Yes, they can. I have had multiple people come from even different clinics that are in other organizations come and they're being seen for a back issue or something else, and then they come and see me for pelvic floor therapy.
All right, thank you. We have another question asking, would pelvic floor therapy be appropriate for a 13-year-old female who is having frequent bedwetting as well as some daytime urgency issues?
Yes.
All right. Can you share a little bit more about how pelvic pain can be treated for endometriosis?
So we can do a lot of different things with that, honestly. We can do external trigger point release into the abdomen, abdominal massage, sacral mobility, low back stuff, internal work as well to calm those muscles down, decrease the adhesions, just making that area a little bit more happy or less inflamed as well.
All right. Thank you. I think that, oh, actually, I think maybe we had one more sneak through. Sometimes when I wake up in the morning and sit up, the urethra feels full, kind of like a bubble. This happened even after going to the bathroom at least twice during the night. Is this typical for a weak pelvis?
Like I've said before, it could be either. It could be weak or you could have a spasm as well down there to feel full or like discomfort down there. That could also be caused by that as well.
Awesome. Thank you. Another question came through. Do you offer any at-home treatment plans?
Yes, we do.
All right. Great. Well, I think that brings us to the end of our Q&A. Thank you once again, Jill, for your presentation and insightful Q&A session. To all of our participants, thank you for joining us, and we hope you have a wonderful rest of your day.
Thank you.